We're going to begin with Range Mental Health Center, and we have Becky, and she has a couple of friends joining her. So I'm going to turn it over to Becky to begin your presentation. Please introduce yourself and let us know who is presenting with you, and you can all introduce yourselves and we'll get to know you a little bit.
Hi, thank you, Amber, for having Range Mental Health Center on this. My name is Becky Kuzisto, and I am the Human Resources Manager at Range Mental Health Center. Today I have with me Sarah Rohr and Emily Mcgonagall, who are our clinical managers, and they'll have a little bit of a piece to say as we get through this. So I would like to start by sharing my screen and showing a little video.
Or said God because I was angry with God then, but I'm sure now I can easily say God's got me because I shouldn't have survived a lot of things that I went through. I had my own suicide attempts and my own beyond risk behaviors and things that I did. I've been clean and sober for 8 years. I went through a lot of suicidal stuff and my own issues with that because of the drug addiction, because of abuse, because of trauma. Range Mental Health has always been there for me. They've always helped me through things. They've always listened. They've always understood. They never judged, so they're part of saving my life. It led into a job here. I'm a peer support specialist. I work with other people in the community who maybe deal with the same type of mental health issues I've dealt with in my life, or chemical dependency issues, because I've dealt with both. It gives good balance to my life. It helps me in return keep focus on my recovery and what I want to get out of life. I guess it reminds me that everybody goes through stuff and it's okay. Knowing that I might have touched one person's life to keep them alive that day, it's all worth it.
Range Mental Health Center is a community mental health center, which means it's designated as an essential community provider, which means we serve all people from birth to the end of life. It started in an office with 2 therapists in downtown Virginia. And so, yes, they grew from that. And we've been the major provider of mental health services in this area for that amount of time.
6 years for anything is a milestone. I mean, to be around that long as a large portion of the community, it's amazing. And to have that support in the community to keep us around.
We are usually there at the most painful points in people's lives to provide the support that they need to become healthy and feel better. And if somebody comes back and says, you helped save me, or I didn't think about killing myself after I had that conversation, or I have found a therapist I really connect with, or my chemical dependency it helped me be healthy, I know we've done our jobs.
We have roughly 150 employees. I would have to say our workforce is compassionate, family-oriented, and positive people. That's truly what I feel about all of us here at Range Mental Health Center.
The frontline workers are the ones that are doing the work, right? Our employees are the people that are out there in the public that everybody sees to do the work that we feel is so important to help people in the community, and they're vital to the success of our organization.
Mental health crisis is among all of us in the community, can hit any of us at any time, and we're just so grateful in northern St. Louis County to have that for our friends and folks in the community who need that. I'm a bridge builder. Led the board by trying to forge as many partnerships as we could to further the mission of the agency. I think the crown jewel of that during my tenure as board president was the establishment of the Wellstone Center. We were happy to partner with the Wellstone family in creating Minnesota's first community-based residential crisis center. People no longer have to go to the emergency room. It's a great example of how agencies and nonprofits and government can all work together for the common good. And we've expanded all our programming, chemical dependency, ADAPT, outpatient services. So I'm glad that that has come to fruition, widening our footprint in the far northern part of the county, because the need is great in the Ely Tower area.
And there's changes coming, as we all know. we're moving into this next decade, so to speak, to become a certified behavioral community health center or clinic. It means that we look at the person first when they come in the door, and we try to get them access and care in a shorter amount of time versus looking at a schedule and seeing where they fit in. And so we're changing our workflows to meet the needs of the people, to be more person-centered. And I think it's the wave of the future in providing mental health care and treatment. And I think it's going to help this organization thrive going forward.
Whew. It's a good.
Okay, so with that, we are a not-for-profit agency. And our services include psychiatry, chemical dependency, addiction and detoxification, case management, ARMS, peer support, homeless and housing, school-linked mental health, a mobile crisis team, crisis assessment and stabilization, and outpatient therapy. So we kind of have an umbrella of services that has something for everyone. And with that being said, I'm going to hand off to Sarah Rohr, our clinical manager.
Thank you, Becky. So yes, I'm Sarah Rohr, and I'm a licensed independent clinical social worker, and I am one of the clinical managers. Emily and I share supervision of our outpatient therapy program, and I also supervise our school-based mental health program as well. So really excited to be here and to have this opportunity to talk a little bit about our services and our program. And I think it's important to know that Range Mental Health Center has, not only have we been around for a long time, but we are always looking to grow and expand and continue to achieve being the best place to work and the best place to provide services for the people in our community. So I've been with the company for almost 5 years, and really during that time have started out as a therapist part-time, and have worked in the school systems, have worked in our outpatient office. I'm actually located in our Ely office. And then have been able to continue to advance my professional growth with the company, supervising some of our outpatient therapists as well as our school-based staff, and really starting to broaden our internship program, which I'm really proud about, and think that we've done a great job connecting with local schools in the area, UMD, Scholastica, and several online programs as well, and bringing our agency into a more expanded community reach, and also being able to see the growth from interns coming in and working with us, and then enjoying their work and feeling supported by the agency, and feeling so good about the work that they've been able to do with clients in the community that they've wanted to continue with us, and have gone on to become employees and have stayed with us and continue to grow in their level of professionalism. So it's a really wonderful opportunity for people to come in, and we do provide paid internships. So that's been something that's been really great for our employees that are wanting to advance their education, as well as for students who are, in the process of getting their education and then need a little bit of financial incentive to help them to be able to continue to grow professionally and academically. So really excited for the opportunities that we have, and I could talk for a long time, but I'm going to hand it over to Emily Mcgonagall, our other clinical manager.
Good afternoon, everyone. My name is Emily Mcgonagall, and I am also excited to be here. I do co-supervise clinically the outpatient clinic with Sarah, and then I am in charge of the ARMS, peer support, and targeted case management programs as well, clinically. And kind of to expand a little bit on what Sarah was saying for the internship opportunities, that is something that both Sarah and I are very excited about. And it's not only our master's levels interns that we're taking on, but we are also really excited to bring on bachelor's level interns. So it creates opportunities for both levels, and we have multiple positions that we're really excited to share and create opportunities for. I've actually been with the agency for just about a year now. And I kind of wanted to share my story. I've recently moved up to this area and was looking around of where to join in terms of being able to bring my clinical skills. And when I saw the advertisement for Range Mental Health Center, and it's a big piece of it is what Janice had talked about in the video, but really just that excitement and the shifts that are happening and how the agency is looking to move into the new decade and become a CCBHC, which is the Certified Community Behavioral Health Center. And what that really means is serving the individual as a whole and being able to not only through therapy, but also through other programs, whether it's ARMS, peer support, services in the school, which is CTSS, but really being able to wrap those services around the individual to help them reach their own personal wellness goal. And I think that those shifts of really coordinating services together and maximizing opportunities for individual that we serve is one of the exciting things that drew me to the agency. And since I've joined, I've just seen so much movement and those moments happening over and over. So I think that is an exciting place of where we're headed, and it's coming just fast and furious for us. So that's a little bit of what I wanted to share with you guys today. And with that, I'll turn it back over to Becky.
Okay, just to wrap up really quick, we do have many positions available, and they start from entry level all the way up to senior level management positions. And to learn more about Range Mental Health Center's history, vision, values, and to apply, you just have to visit rangementalhealth.org. And I'm open for questions.
Great. Thank you. Thank you, Becky, Sarah, and Emily. We appreciate that.